just take what I promise you will be a few moments to kind of create a framework within which we ought to talk about healthcare tonight. And not just healthcare, incidentally. I'm perfectly happy to take any question on any other issue or to listen to any comment that any of you have on any other issue, whether it is a domestic issue, the economic issues, obviously, the budget, deficit, etc., or one of the two wars or both wars that we're currently engaged in, and other responsibilities we have on a global basis. And I'd be very, very pleased to hear from any of you on that. But let me begin with this issue of healthcare. We've been at this for a long time. You know, Harry Truman began this discussion back in the 1940s. And here we are, 2009, going into 2010, and we're still fighting about it. In the United States of America, we spend 50% more than any other citizen in any other developed country for health care that does not make us as well as they are. We, the United States of America, the most powerful economy in the world still, and the groundbreaker in health technology after health technology, or drug after drug, or new procedure after new procedure. I mean, we're good at the technology, we're good at the operation-specific effort, etc. But despite all of those things that we can be first in, we rank something like 37th, 38th in the overall quality of care delivered to our citizens. So you have to stop and say, okay, what do we love about the system in America that we know works for us, makes us healthier, treats us well, allows us choice, gives us freedom, all the things that we appreciate, and how do we take those things and then work them into a system that also becomes more efficient, delivers care more rapidly, doesn't necessarily drop people. I mean, the stories I have heard of people who pay their insurance year after year after year, they think they're covered, whammo, all of a sudden they get the bad news, they've got some kind of cancer or some kind of other disease, and boom, the next thing they hear is, well, you're not covered for that. And they go through not just the painful effort of trying to get the care that they believe they've earned and paid for and deserve, but they go through the second struggle of just getting somebody to acknowledge that they're even covered and that they have a right to have some of this paid for. I mean, those struggles are time and time again. Every year, tens of thousands of Americans are dropped from their insurance. So we have to find a way, folks, to do simple things better. I'll give you an example. I just had my hip surgery, as some of you can observe. We used to keep people in the hospital for 3 weeks for that, the doctor told me the other day. Now they let us out 3 or 4 days later, and you go home and you do some outpatient work and so forth, and we've learned a lot about how to be more efficient. But how many times have any of you walked into a doctor's office and they hand you a clipboard with a pencil attached to it, and they say, would you fill this out before and you sort of scratch your head and you say, wait a minute, I filled this out 5,000 times over the last 60 years in different offices that I go to. Isn't it possible in a world where you can put your ATM card in a machine and get your money and your bank account and everything else to just hand them a card and they got the full record that bounces up on their screen and there you are. Of course we could do something like that.